Hi, I'm so glad you decided to join us today to talk about GERD, gastroesophageal reflux disease. GERD happens when we have a consistent chronic acid reflux causing a breakdown of the function of the esophageal sphincter. We created this video to provide some insight on how to integrate a multifaceted approach, such as combining nutritional changes to manage weight, as well as with diaphragmatic massage to both help relieve symptoms of GERD, because making these changes can go a really long way in limiting, if not eliminating, the symptoms of GERD and possibly lowering intake of medications like tum-ta-dum-tum-tums. When the sphincter isn't working, it can lead to acid reflux or gastroesophageal reflux disease. GERD is the more chronic and severe version of acid reflux. And it can cause that burning sensation in the chest, which you might explain as heartburn. Heartburn is a symptom of acid reflux and GERD. Other symptoms of acid reflux include an acid taste in your mouth, farting, belching, bloating, possibly a dry, persistent cough. Now we're going to take you through the mechanism of what happens with GERD. So we're going to imagine that this glass bottle is your esophagus, this clear glove we're going to imagine is your stomach, and the black tape is your lower sphincter. The lower sphincter is your muscular bowel, which lets food and liquid into your belly in one direction, hopefully down. Now, here's the fun bit. When your lower sphincter closes, it prevents food from the stomach and the stomach acid from refluxing or traveling back upward into the esophagus. If it opens too far or doesn't close tight enough, the food and the acid can make its way back up into the esophagus. As you can see, it's traveling up there. And worse, when you lay down on the couch for a nap or you're heading to sleep at night, that can be pretty troublesome too, because with an esophageal sphincter that's not working, it's not going to close the flap, and all that acid is going to just travel right back up into your esophagus. Ouch, that hurts. Now that I've discussed what GERD is and what the body is doing to allow acid back up into the esophagus, my colleagues are going to run through what nutrition changes you might need to make and some massage techniques that'll help you manage your GERD symptoms and hopefully get some much needed relief.
Hello everybody, my name is Emily. Now, when we think digestive system, we think digesting food. Now, what food we put into our bodies is going to affect the symptoms of GERD and how pronounced they are in our everyday lives. So that leads us to what we're going to be talking about. We're going to be talking about weight management, we're going to be talking about what we should be putting in our bodies and what we shouldn't, and when we are consuming our food and when we shouldn't really be consuming our food. Hope you enjoy the video. Now first off, we are going to start by talking about weight management. Now weight management, keeping control of that and keeping your body at a healthy weight can really strengthen your diaphragm, and by strengthening your diaphragm, that's strengthening your lower esophageal sphincter muscles, which is allowing for a stronger contraction for the blockage of making sure that the gastric juices don't go back up into the esophagus. Another factor to consider is our diet, and this is also connecting to weight loss management. So our diet is really important, especially what foods we are putting into our body, as these specific foods that we are going to talk about can either help the symptoms of GERD be smoothed out so it's not as harsh every day to day, or it can actually increase the symptoms and make it worse. So some foods to consider staying away from is high-fat foods. Fried and fatty foods can help les, which is the lower esophageal sphincter muscles, to relax, which allows more stomach acid to be brought back up into the esophagus. And this can also mess with the digestive system, as this will delay the stomach emptying and allow more buildup in the stomach, which is going to increase the amount of gastric juices going back up into your esophagus. Also, staying away from some citrus fruits can also help with lowering your symptoms of GERD, as highly acidic fruits can cause frequent acidic reflux, which will cause a higher burning sensation in your esophagus, which means that the gastric juices are going to be going up, so then what contains in the gastric juices is what's going to be creating that burning sensation. Some foods that you can consider to put into your diet to reduce the symptoms of GERD are vegetables, as vegetables are naturally low in fat and sugar, and they can help reduce stomach acid. Some examples of vegetables that you could throw into your diet are green beans, broccoli, asparagus, cauliflower, leafy greens, potatoes, cucumbers, etc. Moving on to when to eat and when not to eat. This can play a big factor in your everyday life while treating your symptoms of GERD. They say not to consume food 3 hours before bed and to not consume any liquids 2 hours before bed, as leaving your stomach empty decreases the chances and eliminates the factors of gastric juices being in your stomach and flooding back into your esophagus. As when you are sleeping, you are laying horizontally, and the gravity will increase the gastric juices to go back into your esophagus easily if your splinter muscles aren't contracting properly. So this just eliminates the factors of having the gastric juices flow back into your esophagus.
Hi, my name is Mar, and for this next part, we're going to demonstrate what to expect when you're coming in for a myofascial release treatment. So to start off, let's discuss the pain expectations. So for some, this is not painful, while others it is. So that's why we like to work within a pain scale. 0 being no pain at all and 10 being unbearable pain. Don't worry, we're not going to work there. We'll actually work within a 7 or a 5 depending on if you're taking medications. So we want to make sure that this is manageable and tolerable, and we stay constant communication because you have the right to stop or modify the treatment at any time. But to start off, we're going to assess the area. So I'm going to do an assessment superiorly, and I'm also going to do an assessment inferiorly, and I'm looking for restrictions. I'm doing assessments laterally, and then I'm also going to assess the medial restriction. And another way to assess the abdomen is to take hold of the ribs, and then I'm going to take hold of his lower ribs, and I'm just going to rotate them so I can assess the limitation on the transverse plane. And so I'm just going to doing it gently to feel the restriction. And I'm just going to fix the draping. Perfect. So to continue, I am going to ahead and apply a direct fascia technique. So if the restriction was inferiorly, I'm going to go ahead and I'm going to pin the tissue below the xiphoid process, being careful not to press onto it. And then I'm going to go ahead and apply inward pressure and go down towards the feet. And I'm going to hold this until I feel a release. However, some have specified to hold it for 5 minutes. And for this video's sake, I'm going to go ahead and say that I felt a release. And this really helps open up, and I'm stretching the diaphragm. So our literature has shown that myofascial technique is actually very helpful to all surrounding structures within the body in alleviating pain. And the techniques that we're using right now is to help decrease the symptoms of GERD. Another great technique that I found that was very useful for GERD is I'm going to go ahead and take a hold of my client's ribs. And I'm going to ask them to breathe 4 times. And each time I'm going to go ahead and exaggerate those movements. So as you see, I'm pulling towards the middle, and then I'm stretching it out, going along with his breathing. And I would do that for his 4 breaths. And then another technique that is great is directly contact with the diaphragm. I'm going to go ahead and place my hands below his ribs, and as he's breathing in, I'm going to wait, and then as he exhales, I'm going to apply that pressure. And then I'm going to hold here as he inhales, and then when he exhales, I'll go in further and stay in place. And we'll do this for a total of 4 breaths. And I found these are just a few of the myofascial techniques that we use that are helpful to help the diaphragm release any fascia that may be constricting and stressing our esophageal sphincter. Thank you very much.
Hey, it's me again. I'm here to summarize today's chat on GERD. So what we've learned is that the diaphragm is not only vital for supporting our respiratory function, but it also plays a role in our posture, range of motion, and possible esophageal dysfunctions. Through myofascial release, we can help alleviate adhesions and restrictions in the diaphragm and contribute to an overall well-being through a domino effect. If you can integrate this multifaceted approach of combining nutritional changes and managing obesity into a healthy nutritional lifestyle with diaphragmatic massage, you might just get the relief that you've been looking for. So go ahead, give it a try. Thanks for listening to us today. It was great to have you here. Be sure to subscribe to our channel below, like and share our fabulous facts on massage and nutrition. Have a great day.